Hello everyone, welcome back to our channel Students Homeopathy and let's learn together. Today in this video we will discuss regarding the one-sided disease which has been given under aphorism 173 to 194 of Organ of Medicine. So let's first know what is one-sided disease. One-sided diseases are those which display only one or two principal symptoms which obscure almost all the other symptoms. They are less unable to cure and belong chiefly to the class of chronic diseases. Now coming to their types, there are two types: internal one-sided disease and external one-sided disease, which is otherwise called local disease. So let's first discuss about internal one-sided disease. Internal one-sided diseases are one-sided diseases arising due to internal complaints. For example, headache of many years duration, a diarrhea of long standing, an ancient cardialgia, etc. Coming to the treatment part of internal one-sided disease, the medicine is to be selected based on these few perceptible symptoms. Sometimes it leads to cure when these few morbid symptoms are characteristic. Most often, this firstly selected remedy is a partially similimum. This imperfectly homeopathic medicine, that is the firstly selected remedy, or you can say partial similimum, produces accessory symptoms of medicine, that is the symptoms of disease itself, and it should be included in totality while selecting the next similimum. Thus, a complete picture of disease is formed on which a new, more perfect similimum is chosen. This successive selection of homeopathic suitable medicine is to be repeated until the recovery is complete. Here, we should go through some lines from Kent's Matra Medica, where he has mentioned about forming a complete picture of the disease by prescribing a first prescription on the basis of paucity of symptoms. In his lectures on Matra Medica under Carvovage, Kent writes, "Old ear discharges or old headaches, when all the symptoms have been suppressed. It is then Carvovage often becomes one of the routine remedies to bring symptoms into order and to establish a more wholesome discharge from that ear. It brings about reaction, establishes a better circulation and partially cures the case, after which a better remedy may be selected." Also under Coccus cacti, he writes, "In the early stage of whooping cough, Carvovage will develop and bring out the symptoms and furnish a good picture for a second prescription, even if it doesn't cure." Now, coming to the second type of one-sided disease, that is external one-sided disease or local disease. These are one-sided diseases appearing on the external parts of the body produced a short time previously cheaply by an external injury. However, it is not that these external parts are only morbidly affected, but the rest of the body also take part. But old school physicians considered them as mere local affections and treat them only surgically or with topical applications. Now question arises, what is surgical diseases? Surgical diseases belong to the group of external one-sided diseases, that is, they are produced from external injury. Here, the affected parts require mechanical aid, that is, the external obstacles to cure may be removed by mechanical means, for example, reduction of dislocations. But the external one-sided diseases which do not arise from external injury or have only some slight external wound, arise from some internal malady, they do not belong to surgical disease. No external malady, except some important external injury, can arise, persist or even grow worse without some internal cause or without the cooperation of whole organism. Next, treatment of external one-sided disease or local disease. Local diseases occurring from little or no injury from outside must be treated by internal remedies. No external remedy is needed here. The totality in local disease should include exact character of the local affection, all the changes, suffering and symptoms in the patient's health and symptoms previous to any medicine used. By employing medicine only internally, the general morbid state is cured along with local affection because the local affection is inseparable part of the whole disease. In diseases of recent origin, this cure is often produced after the first dose. Either in acute or in chronic local diseases, external application of medicine is of no use even though it may be homeopathic specific. Rather, medicine should be administered internally. Still, if the disease remains, it means SORA is in the background. In acute or chronic non-venereal local maladies, when SORA remains in the background, a radical cure cannot be effected unless and otherwise an antisoric is given. It may seem that the cure of local disease needs local as well as internal employment of homeopathic specific, but simultaneously external as well as internal employment of medicine is quite inadmissible in local diseases, whether it arises from SORA, syphilis or psychosis, because it causes the local affections to be annihilated sooner than the internal disease and we get deceived of getting a perfect cure. By topical, that is external employments of medicine, only the local symptoms are removed and it makes the disease picture unclear. If the local symptoms are destroyed by local means before the perfectly homeopathic remedy is discovered, the case becomes more difficult because of too indefinite, that is uncharacteristic and inconstant symptom picture. If no external applications would have employed and a homeopathic specific is selected and given on the basis of totality of symptoms, then the convincing proof of complete eradication of disease, that is a perfect cure, is the removal of local affections. When vital force becomes unable to overcome a chronic disease by itself, it develops local affections to silence the internal disease for a time and save the vital organs. As the internal disease gradually increases, the local symptoms also enlarge and aggravate more and more. By destroying local symptoms by external means, the old school drives them back into the system or upon the nerves and increases the internal disease. Removing the local symptoms by external means without curing the internal miasmatic disease is the cause of innumerable chronic maladies. According to Hahnemann, it is one of the most criminal procedures the medical world can be guilty of. Examples of external treatment are driving off the psoriatic skin eruption by ointments, burning away the cankre by caustics, destroying condylomata by the knife, ligature or cautery. So let's quickly summarize all this. One-sided diseases are of two types: internal one-sided disease and external one-sided disease or local disease. Internal one-sided diseases are one-sided diseases arising due to internal complaints. External one-sided disease or local diseases are one-sided diseases appearing on the external parts of the body produced a short time previously, chiefly via an external injury. In external one-sided disease or local disease, whole body is morbidly affected along with the injured external parts. Surgical diseases belong to the group of external one-sided diseases, that is, they are produced from external injury. In internal one-sided disease, medicine is to be selected based on these few perceptible symptoms. In this case, mostly the firstly selected remedy is a partial similimum. It produces accessory symptoms of medicine which should be included in totality while selecting the next similimum. Thus, a complete picture of the disease being formed. No external malady, except some important external injury, can arise, persist, or even grow worse without some internal cause. Local diseases occurring from little or no injury from outside must be treated by internal remedies. In non-venereal local maladies, when SORA remains in background, a radical cure can only be effected after an antisoric. By topical, that is external employments of medicine, only the local symptoms are removed, which makes the disease picture unclear. Simultaneous external as well as internal use of medicine is quite inadmissible in local diseases, whether it arises from SORA, syphilis or psychosis. If no external application has been employed and a homeopathic specific has been administered, then the convincing proof of a perfect cure is the removal of local affection. So that's all for this video. If you have not yet subscribed to our channel Students Homeopathy, please subscribe it now and also click on the bell icon and select all so that you will not miss any of our informative, educational and interesting videos on homeopathy. Please provide your valuable feedback in the comment section below. We will love to answer your queries on this topic. Thank you for watching.